No, it didn't say cattle on the thing.
Yeah, I was hoping.
Sorry, pregnancy brain.
Big crowd. Got a big crowd, because we're looking.
Pass out the OxyContin here in just a minute.
We thought you were here signing those,
Yeah.
medical cards.
You need some botanicals, you know, for your cattle.
Yeah.
Bird's got a dispensary, I see that.
Oh yeah, it's been there for 3 or 4 weeks. I don't know how busy those things stay, but every now and then I'll see a car or two parked in front of there. First of all, I have a guest here this morning. This is Mark Tuberville. Mark is a senior vet student. He graduated from TCU, and now he's a senior vet student at Louisiana State University. And so Mark has been at the clinic. It's be his 4th week, and so we're glad to have him, and so he'll be graduating here real quick from down in Louisiana. So give everybody just an update on the clinic. I think most of you guys know that I sold the clinic, you know, and I will be leaving at the end of June. Dr. McKinney, Dr. Ferguson, and Dr. Bro will all have own a piece of it, as well as a company called Alliance Animal Health. So, you know, it was just a good deal for me, and I don't know that I was ready to sell it, but I didn't want to look back 5 years from now and say, gosh, I wish I'd have sold it back then, you know. So it'll be in good hands. I don't think, again, that happened December 1st. We're 3 or 4 months into it already, and I don't know that you're going to notice any change. So it'll be in good hands. I probably will continue to work a couple of days a week after that, after June. Been asked if I would work a couple of days a week afterwards after June, and I probably will. We'll just see. But anyway, I just kind of give you an update on that. We do have another veterinarian hired. He's an Oklahoma State guy. He will be here. Well, he graduates in May, so shortly after May, he'll be here. Shortly after May, he's name's Tanner Leon, and he's up from by Enid, Oklahoma. He's actually coming down sometime a week in April to spend a week with us, but and we're looking to hire one other vet besides Tanner. So, all right, I'll get on with the topic: stress and pain management in cattle. Really becoming a hot topic, you know, in our industry right now. We've always known stress was a. What do you need me to stand for? Here.
Sure.
We've always known that stress is a big factor, you know, in cattle, but nowadays pain management is becoming a big deal. We have some data, you know, that shows if we can control the pain, we can also increase the performance of the cattle, which in turn is going to help, you know, pay for that pain management. You know, again, I've already hit on that stress and the pain is going to reduce, have a negative effect on the cattle. You know, we all know what these stressors are, you know, weaning, transportation, quick changes in weather, processing them, you know, castrate, dehorn them, giving them shots, you know, all those things are, you know, stress factors. And, you know, if we can help eliminate some of those, you know, it's going to reduce the stress and therefore increase the performance of the cattle. Why would you want to control pain? Again, we've already talked about it increases the performance, but you know, you guys may want to start selling to a specific market, you know, and there are going to be people that dictate, you know, such as Walmart. Okay, Walmart's going to say, we do not want your cattle unless they've been given pain control, you know, pain management. And that's something that's being dictated to Walmart. Walmart's going to dictate it to you, or Whole Foods, or whoever. And so it's, guys, it's coming. Believe it or not, you know, this pain management is coming, and you know, you're going to be dictated that you know, we want to know that your cattle were treated for pain when they were castrated, when they were dehorned, etc. Okay. Again. You know, there's some of the performance data, you know, calves that got a, when I say NSAID, that stands for non-steroidal anti-inflammatory drug, and that would be a non-cortisone drug. That would not be a cortisone. Okay, so cats that got an NSAIDs would be products like meloxicam or Banamine. Banamine comes both injectable and transdermal. We can pour it down the back. So cats that got NSAID at birth gained 10 more pounds after, not 10 more pounds, gained more weight after the first 10 days of life, than those that didn't. Up in Canada, they did spayed heifers, and the heifers that got that were spayed, that got a NSAID treatment, pain management treatment, before they were spayed, outgained the outgained the spayed heifers that didn't get pain management, and did just as well as those counterparts that weren't spayed. And so and again, a lot of the data right now for pain management comes from Canada, because they've been doing it up there for years, and they have approved drugs up there. They have meloxicam injectable up there, where here in the United States we only have meloxicam tablets. But there's going to be, a lot of the data that has been generated is coming from Canada, and you're going to see a whole lot more data in the next few years generated on pain management. Out at a feedlot out at West Texas, they castrated big bull calves. The big bull calves that got pain management did just as well as their steer counterparts, but the ones that didn't get pain management didn't gain as well. Again, this is just some data that shows, it does increase the performance of the cattle. When we helped, when we use these NSAIDs. This guy Coatsy, he's up at K-State, and he showed that calves that when they were castrated and given an NSAID, that they were less likely to have bovine respiratory disease. And Coatsy's a guy here in the United States doing quite a bit of pain management data now. Now again, he's up at K-State. Again, they're consumers. They're not interested in scientific data. We can give them all kinds of scientific data, and they don't make buying decisions based on scientific data. They make buying decisions based on emotion. And if they think castrating that calf, it hurts him, they want a calf that, had pain management. They want a calf that wasn't dehorned. And, so it's we can talk, we got all kinds of data on implants. The implants are safe. But, Walmart now wants a non-implanted cattle. And that's a consumer-driven thing, And so, we can talk till we're blue in the face, but again, they're making buying decisions based on emotion, and that's why you're going to start doing pain management soon. Another thing is it reduces antibiotic usage. If we can reduce antibiotic usage, that's becoming a biggie nowadays. To try and reduce antibiotic usage. We're getting blamed for resistance, in people, that people are getting sick because we use so much antibiotics in cattle. We're being blamed for that. So if we can, if these cattle perform better, they're healthier, we're going to reduce the antibiotic usage. I'll just share with you a little data that at the last ABC meeting I went to, they had some data, and they have a deal now called a leukogram, and they're working on getting it at chute side. And so basically they're going to put a blood sample on your calf right quick. They're going to put it in a little machine, and it's going to spit out some data. Leukogram is really kind of a measure of white blood cells. Okay, so they have found that a third of the cattle on this leukogram, a third of them, regardless of what antibiotic you gave them, they're not going to respond. That's on the bottom end. A third of them on the top end, regardless of what you gave them. You could have gave them sewer water IV. They're going to get better. Regardless of what you gave them, they're going to get better. We're only influencing those middle third of cattle, So there's 2/3 of the antibiotic usage right there that we can eliminate if we can start, if they get this leukogram thing honed down, so there's 2/3 of the cattle that we won't even be giving antibiotics to right there because, of a leukogram, so there are all kinds of ways, pharmaceutical companies are trying to appease the public, that we're reducing the antibiotic usage. And so, it's a biggie. It's a biggie if we can do it. Yeah, Don?
Are we gonna figure that out on the farm?
Well, I'm sure a pharmaceutical who's doing that research right now, I can't exactly remember, but who presented it, but I'm sure a pharmaceutical company's gonna buy that from them, and they'll be the ones pushing it, because, they're gonna lose money. They're gonna sell less Draxxin, they're gonna sell less Nuclear, they're gonna make that money up somewhere. And what will be the price of that machine, I don't know, but it's gotta be, they gotta get it small enough and quick enough that it doesn't slow it down, but, we're only affecting, they found out that we're only affecting that middle third of the cattle, 2/3 of them probably, it's not gonna make a difference. Katie?
Is that genetic at this point?
What's that?
Is that genetic at this point? Or is this
Well, that's a good question. In some of those, especially on the top end, that may be a genetic thing, and that we can look at that and start, moving toward that way. I thought of that when I first saw that data, and it was presented at the ABC. That's kind of what I thought, those things. There's a genetic superiority out there, and that's what we need to be looking at, is that end of the cattle right there, that we can promote that, and reduce antibiotics. But yeah, I would say that there's probably something there, on that side.
What's the cost? As we speak, what's the cost to?
Pain management or leukogram? I'll get into it. I got it. I got the cost for you. I just scanned that in last night, so it doesn't come off very good, but this is the AABP. That's, one of my association deals. That's American Association of Bovine Practitioners, and they're calling for pain management, in our profession. So, what are drugs that we use for pain management? Well, when I got out of vet school, it was dexamethasone. And we still use it to some degree, okay? But, we might have a bull come in, a steer, a cow, limping. We can't find anything in her foot. We assume it's higher up, so we're going to give her something for pain. As long as that cow wasn't pregnant, we gave her dexamethasone. And we might give it one daily for 3 days. And so we would administer dexamethasone. Not used much nowadays because we got better drugs, and you got to be careful if you're going to give it to a pregnant cow because you will abort her. The other thing is dexamethasone is a very, very potent immunosuppressor. Suppresses the immune system. It's used a lot in research, so if we want a calf to get pneumonia, we can give it a shot of dexamethasone. It'll suppress its immune system. We can make it get pneumonia, I used to have a teacher at vet school, he said they die feeling good, give them a shot of dexamethasone, they die feeling good. Lidocaine, that's kind of like when you go to the dentist, and they numb you, that's lidocaine, or lidocaine, and that they'll use lidocaine. The problem with lidocaine, it does control the pain, but it's very short acting. It's kind of like, you go to the dentist, it's worn off later that afternoon. It's just a very, very short-acting drug. Aspirin used to be used some. It's an oil product. You either got to give it as a bolus, or you got to buy it in a powder form and crush it up. It's just, and I'll be honest, I'm not even sure if it's an approved drug anymore. I'm not sure that it didn't get taken off. Here's the biggie nowadays is transdermal Banamine. And that's the one we pour down the back, 3 cc's per 100 pounds. There's a lot of data out there now being done on transdermal Banamine for pain management and performance data. You start between the shoulder blades, pour it to the tail head. So while that costs 84 cents a 100. So 5-weight steers are going to cost you about $4.20. Not cheap. Not cheap, but you may be someday,
But
maybe.
With this, the data they have, will that pay?
Yeah, yeah. And the other thing is, there's things that we can do earlier to that calf. You know what I'm saying? We don't want to cut him at 500 pounds. Let's cut him in a lot lighter weight, and it's a lot less stress on him. Let's don't cut him at 500 pounds. Let's cut him, day one. And just like docking a puppy's tail and taking the dew claws and a puppy tail. Let's do them at an early age, and they just get over it a whole lot better and everything, But if you're going to start buying these 5, heavier weight bull calves, you're going to have to. I think down the road you're really going to have to discount them because of what you're being dictated by somebody, like Walmart saying, if they hadn't had pain management, we don't want them. It's going to be hard to sell those cattle. So if you're buying heavyweight bull calves, you may have to discount them in the future. Severely discount them.
Bruss, how fast does that work and how long does it last?
It lasts about 48 hours, Steve. So 2 days. You could do repeated treatments. That Coatsy, that guy from K-State, showed that it lasts about 48 hours. And so, the injectable probably doesn't last that long. The Banamine injectable, because it's given IV, has to be given IV. It probably not that long acting, but the transdermal Banamine, the back stuff, has been shown to last 48 hours. Meloxicam, that's another one that's used a lot. Meloxicam is, we use a 50 milligram tablets, tiny tablets. So if you're giving a calf, treating an individual calf, you put that in a balling gun, you got to keep that up like that, grab the head, and you don't want those things to fall on the ground. That's the problem. D. Griffin made some little balling guns out of some tubing the other day, they're real tiny, stuff them in there, and he's got a little push rod made out of plastic that I haven't tried it yet, but probably would work. I can imagine the calves biting into those things, but he made a little deal for those Meloxicam, and Meloxicam works good. Again, it's an oil product. We actually have had put bulls on it or cows. We put them on it. We'll give them 5, maybe several hundred Meloxicam tablets and just let them crush them up, put them in the feed, or put them in their hole because they're tiny. If they don't eat them, then start crushing them up. You still find the tablets in there, you'll have to start crushing them. But Meloxicam does good too, and it lasts about 48 hours also, Steve. And it's a daily deal, whereas given daily.
So, Bruss, you're saying that the retail side is really pushing this. So I'm assuming at some point we're going to have to offer up some certification that we did use
Exactly.
pain management.
Exactly. Yeah, you'll have to have
A vet certification or something.
something to the effect. Yeah, these calves are, or they were. Even if they were done, say at 3 days of age, you know what I'm saying? They were certified, and they would give them pain management.
Bruss, is that fast acting enough to be given for castration or dehorn, or does it have a slower impact as far as managing it?
Well, they would like for you to give it a few hours ahead of time. That's where the problem lies. Really, if you're going to run them through twice, do it, and then run them back through, and then do the process.
That's additional stress.
Yeah, it is too. Yeah. Do them at an early age. Do them at an early age. Probably what's going to happen though on that, Harold, is it'll be a combination of lidocaine, which I said is very quick acting, but doesn't last long. It'll be a combination of lidocaine, so let's say dehorning. So we're going to do a horn block, and then we'll give them, which will take care of the pain there, okay? And then we'll give them Meloxicam when they, before they leave the chute. So we got some, quick acting there with lidocaine, a longer acting with Meloxicam. So it'll kind of be a drug combination deal. Now, what does that mean on the processing end? It probably means the processing fee is going to go up because you know those calves come in there and standing one here, and here's its butt, and here's the head, and it gets crapped on, and you've got to clean all that off. You just can't go start sticking needles in there and carry manure and stuff like that, and then you get an abscess, So we're talking, the processing of those fees probably going to go up just because it's slow the time down considerably.
Do you like meloxicam better than Banamine?
No, I like Banamine just for the ease of use. Anytime you got a hired hand out there lifting heads up, it becomes dangerous,
Yeah, well, you talk about keeping the lidocaine and the meloxicam, it looked like to me the easier thing with the labor situation would be to do the.
Yeah. It's just, again, if we, that 84 cents a hundred versus 4 cents a hundred. Meloxicam's cheap. At 4 cents a hundred, you know what I'm saying? It's very, very cheap. So a 5-weight steer costs 20 cents versus $4.20, on the Banamine. And so it's just very, very cheap. And we like I say, we've treated some of those bulls, that have stifled themselves or sprained, maybe even pain from foot rot, or we took a toe off. You can still treat those bulls real economically with meloxicam in the feed. Don?
Yeah, that may be cheaper, but if you're gonna have to bring them back in and treat them daily, that's gonna be a labor intensive plus,
Well, if you can feed it in the
a lot more
feed,
stress.
if you got him singled out and can feed it in the feed,
Okay.
then I would.
Consuming's the problem, though, even out there stressed.
Yeah, they gotta eat. Does a sick calf eat, or does a calf that's sick not eat?
That's the problem.
Or if you're weaning, how do you go through, you have to run them all through, and if you cut them all and you're trying to give them like for a week, how long is that recommended for after you cut them? Or being
Well, I would just do it one time. I'd get 48 hours of pain relief, Because if you watch cattle that are castrated and banded, the castrated calves, you castrate them and they'll lay around about a day. You band them, they'll lay around several days, And you ask me, give me a knife, I want to cut them with a knife. But, I just think that, yes, they both hurt the first 24 hours, but the calf that he was cut with a knife, and he's out the second day, he's up eating and going a whole lot better, In fact, the guy that did that research up at K-State, they had like 100 calves, and they banded 50 of them, and they castrated 50 of them, and they weighed them after 30 days, and all the castrated calves outgained the banded calves after 30 days, It's just them banded calves, they do a lot of laying around. You've seen it, those sack, it's nasty and stinks, and, so I'll take a knife any day. Again, the meloxicam's cheap. Just gotta pick her heads up. If they're, got a calf in the chute, if you send him home, you can send him home on meloxicam and put it in the feed, crush it up. Anesthesia. Anesthesia is not pain management. Anesthesia is knocking them out. And, I have a farm ranch that I go to, and we do several hundred of them. We knock them out to castrate and dehorn. And, so they're knocked out, they're castrated, they're dehorned, and they're given pain management. And, again, you guys would not. The most commonly used drugs for that is romping ketamine. You guys wouldn't have access to ketamine. It's a controlled drug, so you guys couldn't do that. But it may come to the point someday that they're all done that way. These are lightweight calves, probably, 80 to 120 pounds that we knock out. Joe Bob, do you have a question?
Can you tell any of the performance of that outfit that knocks everybody out? As far as pain management or?
Joe Bob, I would say this. I'd say it's probably a public relations thing that, we're trying to appease the you know, the soccer moms, you know. that
But you can't tell me any upgrade in the performance.
I don't know that it's been tracked where I've gone, okay?
Okay.
I don't know that it's been tracked where I've gone. But again, other than the other data, if you try to correlate it with the other data, the performance is better, you know. I would have to say, yes, there's probably some data, but everything gets it, so we don't have a negative control group, you know. If you just go back and correlate it to the other data, where we show pain management helps, you know, because they're getting pain management. They're being knocked out, and so, you know, they're not feeling up all they're knocked out. It's much more expensive, I will tell you that way, you know what I'm saying? Because a veterinarian's he's not gonna sell you that drug. If he does, he's gonna get in big trouble. It's a controlled drug.
So that-
Adverse effects from using that kind of drug.
Yeah, Steve, there's some, you know, you have to worry about the MDUCA laws and stuff like that, using, you know, those drugs, you know, do not have an approved use in cattle, okay? But I will tell you this, the FDA kind of turns their head right now on pain management. Meloxicam does not. In Canada, it does approve. In the United States, it's not. But the FDA, because of all the pressure that's being put on by animal welfare people, the humane groups, the FDA is kind of turning their head right now on, you know, using drugs to help control pain, you know. So, Katie?
What about ACE? ACE?
Oh, ace it's just a sedative, you know.
It's not enough.
It's it's, you know, I would see no benefit from ACE, Katie, you know what I'm saying? I mean, it might sedate
I
them.
do that anyway, but that's, I mean, I know that we buy ACE.
Yeah. I don't think it's gonna give you the desired effect. It probably, you know, with what we're doing there, you know what I'm saying? They go to sleep. You know, we're knocking them out. They go to sleep, you know, they're up in 20 minutes, you know. So those calves they're asleep. And
So Bruss, their process, they run them through and you give them a shot of romping every one of them, and as soon as they fall over on the
well,
ground.
that's a cocktail of romping ketamine,
Right.
Rick. It's
Right.
a, you know, cocktail of romping ketamine with some sterile water, you know.
Mhm.
And so I actually, you know, yeah, we administer that to the calf.
And you let them,
We
you
knock
let
them down, you know, we just go in a roll like
Yeah.
so, you know, they're not actually in a chute.
while they're out.
Put their
you feel
head in
them
it, we put their head in a, there's an opening there, we put their head in it, you know. The guys pull their head around the IV and,
Mhm.
you know, I go to the next one, there's a crew comes behind me, and they're castrating and dehorning. You know. Now, I will say this, I started this close to a year ago. I started that back in March, 2019. I do a whole lot less I'm not gonna mention farm's name, but some of you know, okay? I do a whole lot less castration and dehornings right now than I did March of last year. And the reason being is genetics. We're now using polled bulls, and also we're using sex semen. So we're having mostly heifers. And so we used to, it took us a long time to do that many calves, but nowadays we don't do near as many as I did a year ago, and that's because of genetics and pressure from the, you know, consuming public, you know. Joe Bob, you got a question?
No,
You got a question.
Processing.
I just think they're giving up a lot when you give up the performance value for your steers or whatever. It's costing a lot to do what you're doing too, so,
Yes, it is.
I mean, that's not free, I can understand that.
Yeah.
taking the time to IV every calf and then work on it, that's a lot of time.
Well, it really doesn't. In all honesty, Rick, it doesn't take long.
No?
No. I mean, there's a guy in there. He grabs a calf. You know, he pushes him up to me. He turns his head around. I'm there. I IV him, and You know, I break that needle down, put it in, I got to carry a trash deal back here, you know, loading up the next fringe, going to the next calf, you know. That calf's laying down, the guy that pushed him up to me, he stays with him till he lays down. He walks out, you know, there's a crew coming behind. It doesn't take long.
There's a crew
It doesn't
behind you
take
that's
me-
doing all the.
I don't do
dehorning
the
and all that.
castration dehorning, okay? I don't do that. They just need me to knock them out.
Right.
I don't do that.
They probably have different facilities than the normal person.
So we try to do the castration when they're younger, and we don't have any with foals. If we take them to the sale place, we may in the future need to prove we gave them pain management, or
Like, that's what Rick was talking about, some type of certification program. You have to
Right.
certify that those calves were given pain management, you know.
So we need
Now,
to
is that gonna
start now.
happen, is that gonna
So-
happen in year 2020 or 2025? I don't know, but I can tell you it's coming. Even in my veterinary association, they're pushing it, you know what I'm saying?
yeah.
Because we're being pushed by animal welfare people saying, you guys have got to quit doing this to these animals, you know, we're being pushed by animal welfare.
They don't even flinch though. I mean,
QA or something.
Is it cost effective? I mean, Bruss, Joe Bob to Bruss, is that cost effective to do this? Will that calf gain better,
Yes, yes.
enough to pay off the extra 480?
According to Kusi.
Depends on how long you keep him, but yes, you can recover that cost, Joe Bob, I'd say if you keep him 200 days, you know.
Maybe we have to look at it as a value added.
Exactly. Now, yeah, it'd be a value-added thing, you know what I'm saying? Those calves that don't have pain management, someday they're gonna be discounted, you know?
Well, so your value added is as far as your gain, right now, that's what you're looking at, but in the future, when you get that certification, you should see that your market is gonna open up. It's
Yeah, again, I don't know if, you know, if they're gonna push it in 2020 or it'll be 2025. To be honest, we're headed there, you know what I'm saying? It's probably in 2 or 3 years, you know, we're gonna be there and,
And something maybe BQA would just implement and add to their program or something.
Yeah.
similar to that.
it's, you know, all these medications you'd want to administer according to BQA guidelines, okay? You sure want to administer them according to BQA guidelines, that they were administered properly, you know, and that type of stuff, you know. And I'm gonna be back to the meloxicam, you know, if you give it with a balling gun, you gotta be careful because the tonsillar tissue of cattle, you got their head lifted up, you're giving them, the tonsillar tissue of cattle is notorious for having salmonella, okay? So if you give it this calf and you're going on this calf and then this calf, you know, and you don't need to disinfect between calves, you know, you better have you a water bucket there with some disinfectant in it and disinfect that balling gun, or have you several and just, you know, disinfect it. But if you're doing mass cattle like I do, you know, you better disinfect that thing between, much like an implant gun, you know what I'm saying? We keep that thing over there in one of those roller paint things, you know, with the sponge that's wet with novice hand disinfectant, you know, so much like that, you just want to keep that thing disinfected.
As far as value added, we're already seeing that between some of the packers and the feed yards. They won't buy them unless they've got PQA and applying some of these procedures.
Right.
More that way.
Yeah, didn't Walmart sign a big deal with somebody, some cattle with a Creekstone or somebody like that?
They now own their own, yes, they signed a direct contract with an Angus producer in Texas, so
That's
they
right.
now own their own beef,
Yeah.
basically own their own beef cattle company.
Yeah, and they will dictate what those cattle receive too, you know what I'm saying?
Russ,
Yeah,
you're saying like, you bought a load of 5-way bulls, you know, at a $10 discount to steers, you give them the Banamine, cut them. Are you saying the performance is gonna be fairly similar to what the steer would do?
yeah, I'd say if they're getting pain management, Jerry, that's what Coat Seeds research shows. You know, that if those cattle receive pain management, that they outgain the bull calves that didn't get pain management, okay, and they do just as well as their steer counterparts.
Start buying bulls.
You're not adding the labor in there though either.
Yeah, with the discount, I mean, there's a big discount on a live-weight bull versus a steer.
Yeah. Is it 10?
But you also have to take into account there's a chance for infection and loss anytime you have it over in store as well.
But that, again, those are some of those stress factors, you know, we try
Right,
to eliminate. you know.
Did somebody out in Lawton say that the respiratory problems with the bulls compared to steers was a lot higher?
Oh, yeah, exactly, yeah, there's plenty of data for that, Mike, you know, that, you know, there's a big correlation in that, yeah.
Is that probably because the bull's never been in the chute? And
Probably so,
steers
and
have?
it probably hadn't had any vaccination, that's the first one that received, yeah.
But you had something on there too, that like BDD or BR,
BRSD, yeah,
that it could be decreased with pain management.
right.
That's pretty interesting, but a lot of this is in the early stage
Well,
studies.
you know, one of the things they do in pain management, you know, is they look at cortisol levels, okay? And so, you know, it's hard to evaluate, you know, that calf and, you know, I mean, we could lidocaine him and dehorn him, you know what I'm saying? He still may be doing, you know.
I mean, you don't have them fill out a 1 to 10 survey.
So one of the things they do is they measure cortisol levels in these calves, and those calves that have lower, you know, have lower cortisol levels, you know, those are generally the ones that were given pain management. Cortisol is a cortisone, much like dexamethasone, and so it suppresses their immune system, and so it makes them more susceptible to get, you know, bovine respiratory disease, you know, and so that's, you know, that's one of the measuring sticks of, you know, pain management. But yeah, because there's not a, you know, are you a 5 or are you a 10? You know what I'm saying? It's because it's hard to visually say, you know, well, that calf's not balling. You know, you know, it's hard to assess it that way, Katie. You know. Okay, moving on. What are we going to do to control, you know, pain in the future? Genetics, as I said, you know, we can start selecting for polled cattle. I'm sorry if I offend these Hereford guys, you know, horn Hereford guys, but, you know, we can start selecting for polled animals. You know, we can take the horns off at birth. You know, we can take them off before they're born. And so that is going to help tremendously.
We don't see as many horn cattle as we used to.
Exactly. Exactly. And
Unless these, you know, they have these exotic lines. Yeah, they're whole thing different.
they're not going to dehorn him anyway,
No,
Steve. You
no.
know, they're not going to dehorn him anyway.
But there's not that many horns, and they're discounted, they go to the market.
Yeah, and I do think that dehorning is harder on them than castration, especially if you're dehorning a heifer and trying to clean her up. You know, if we're tipping them steers, you know. But man, even those guys say, "Well, I want all them bull calves dehorned," you know, slick-headed. I just think it's much harder on them than. You know, I'd rather tip the steers and maybe clean the heifers up. You know, but you know, we can help eliminate with genetics. We can dehorn at day 1 of age. If you'll take a number 40 clipper blade, you don't even have to be like near electricity. You can get battery powered clippers, clip around that horn bud. There's a dehorning paste you can put on there. Put that dehorning paste on there, put a piece of duct tape over it. Works great. You know, takes the horn off. And, you know, if you got horn cattle like that, you can do that. Again, do the dehorning at an early age. Cut them earlier. If you want to cut them earlier, you know. After they've nursed, let them nurse first, let them get colostrum and everything, and do those things. I'm still a believer that surgical castration is much less stress on them than banding is, okay? Freeze branding, very time consuming, but not near as hard on them as a hot iron. And one of the things that you're probably going to see a lot in the future, I call it chemical castration. And we're just gonna give them a shot, and their testicles are gonna shrivel up. And, I think we're gonna see more and more of that. They're doing some of that, with places where they have, trying to do it some on wild feral dogs and cats and stuff. They're doing it on wild horses, things like that. And I think they're probably going to try to move that eventually over to cattle, where that you give them a shot. And I think basically so the testicles produce testosterone, and it's actually going to be a shot that's going to produce an antibody to the testosterone. Therefore, it neutralizes the testosterone. We don't have don't have that hormone produced, and so it takes away the the bad effects of testosterone in those cattle. That's why we castrate them anyway. Okay, go ahead, Joe Bob.
On Bruss Horn's scale of 1 to 10, castrating here, banding here, where does chemical castration fit in that?
Well,
1 to 10.
I just don't know much about it. I know they're doing it, Joe Bob. It's not available to us right now.
Okay.
One, it'll have to be approved by the Food and Drug Administration. But I would say, they're going to look at, can we use it on a day old? Can we use it on a 6-month-old bull calf? And what's a drug withdrawal time before slaughter and that type of stuff? But I do know that it is being used some now for animal control population, and I think that you're probably going to see it. Some of these pharmaceutical companies are going to jump on that quick, and and so if we can do, just don't make an accident and give it to your prize bull that I spent $30,000 to get him on the ground, and my hired hand gave him the wrong shot.
Or you slipped and gave it to yourself.
Or give it to your wife, right? But, move on, Mike.
He just wanted me to be careful with it, but don't give myself a shot.
Yeah. I'll give it to Gina, Steve. That's my presentation. I'll be happy to answer any questions, and I think that you're going to see a lot more. There'll probably be some new drugs that are introduced. They'll probably, work the meloxicam some. We may be able to get a injectable form here in the United States like they have in Canada. I think that you'll see some, it may be tweaked a little bit. The Banamine may be tweaked. They'll find that we may make them extended releases, where they last longer. So I think that you're probably going to see some stuff like that down the road from pharmaceutical companies, because again, it's the public that's demanding that. You guys all know that you've heard, it's got to hurt them so bad, that's got to hurt, Hey, that's who we want to, that's who's buying your product. So we got to make them happy, Don. Got a question?
Do you only get IV?
For cattle, it is only labeled IV. It's a not. It
Yeah,
is.
but it's labeled IM for horses, which is like huge
Yeah. It is not a very tissue-friendly drug. Okay. Used to they do these what's called slice and dice. These drug companies would come out 2-3 weeks ahead of time and give these. Jerry might have some animals out there that are chronically ill, and we're going to give them all these shots, monitor what, make note of what we gave to each calf, and then we're going to go out there and put them down, and we're going to slice and dice them and say, here's Banamine, here's New Floor, we'll show what's tissue friendly, what's, we'll give some vaccines, and here's Blackleg, and Banamine is not very tissue friendly. So it is not, doesn't meet BQA, you know what I'm saying?
Right.
It's we're following beef quality assurance guidelines. Banamine is not to be given in the muscle.
But it's in Resflor, isn't it?
Resvor Gold. Yeah. That's the only, Mike, that's the only product that I know, a combination drug, and how that thing got approved, I do not know. Well, it used to be, and there used to be a product called Hexasol, and that was oxytetracycline and Banamine. It's been pulled off the market. I don't know how long Resvor Gold will stay on the market because it's a combination drug, and man, they pull those things, used to, years when we were growing up, penicillin and streptomycin. It was pulled years and years ago. All these combo drugs, the Food and Drug Administration does not like them. I don't know how they got that approved, but they've already taken Hexasol off the market, which had Banamine in it also. Right now, that is right. It can be given, but they say the carrier that they use in Resvor Gold is different than the carrier that is used, in the Banamine. So therefore, it's not, it's more tissue friendly, and that's how they got that like that.
What about withdrawal time on all these pain?
Meloxicam, I think, is 15 days, Katie, either 15 or 30, I can't remember. That's kind of what we follow. And Banamine, I think, is 9 days. I'd have to go back and look, but I think,
But they're pretty
yeah.
cool. Same for Roundup.
Again, Rompin's not approved for use in cattle, okay? But we follow a 10-day deal, You can go to a deal called FARAD, stands for Food Animal Residue Avoidance Data Bank, and you can look, put a drug in there, and it'll give you some guidelines on maybe, if you gotta use this drug, what withdrawal time would you follow, So FARAD is always out there, if you don't know.
The gentleman that presented behind you down at Malton the other day, presented everybody the little tubes.
That's D. Griffin.
Everybody observed on the tubes. I don't know how easy they are to use. They look easy, but,
That's what I said. D. Griffin passed some of them out, and it's got a little plastic push rod. I would think it'd be hard to put the meloxicam tablets in there, even though they are tiny. And even a young cat's got teeth, Harold. You know what I'm saying? Just don't know how
it made it look easy.
how long those would last. I brought some home, and he gave a do-it-yourself sheet to how to build them. So. All right.
Thank you.
Everybody have a good day.